Well, let's talk about that situation at the border. It's 40 kilometers or 35 kilometers stretch of a backlog. Then joining me now is Dr. Patrick Amoth, is the Director General, Ministry of Health. Dr. thank you for making time for us. So what types of kits have been deployed to test the drivers at the border point?
Thank you, Trevor. Kenya continues to use the WHO approved and recommended kits called the PCR, the polymerase chain reaction kits, which uses a small part of the virus that is then multiplied in the laboratory. And once that is multiplied in the laboratory, then we plot a graph against the actual viral particles against a control, and that tells us whether you are positive or negative.
But how long does it take to test one driver, Director General? Because we've seen a lot of backlog there.
On average, it takes about 6 hours to be able to deploy a test to the release of the full results. However, for economic sense, we do what is called batching, where we collect a sample of up to 96 specimens, put them together and run them against control, because this makes economic sense, so that we don't run out of the controls, because without a control, then your test becomes invalid. So it is imperative that we take that sample size. But sometimes that leads to a problem, because to be able to collect 96 specimens takes a bit of time. We are cognizant of this challenge, and that is why us, together with the respective county governments in Busia and Bungoma, we have deployed additional healthcare workers to hasten the process of sample collection from the truck drivers, so that we can be able to ease this burden of the backlog of cargo flowing into Uganda.
So who's covering the cost at this particular point? Is it the drivers? Is it the truck owners? Is it the government? Who's covering the cost for this test?
Since we started testing for COVID-19, the government has continued to shoulder this responsibility of covering the cost of the testing. And we anticipate that that will continue going forward. It is a national responsibility of the government. And we want to thank all arms of the government for the support that has been accorded to the Ministry of Health in ensuring that, despite the global supply chain challenges, we have testing capacity in country.
So DG, where is the challenge here? Is it in the relaying of the results to the truck drivers, or is it in the specimen sampling of 96 of them specimens that you said you need to get? Because there's a lot of backlog there at the border point.
The backlog arose because at one particular time we ran out of the sample collection kits. We have two types of kits. One where we collect from your mouth, called the oropharyngeal kit, and one that passes through your nose to the back of your throat, called the nasopharyngeal kit. At one point, because of our increased testing capacity and global supply chain challenges, we ran out of the kits, and for a particular period of time, we are not able to keep pace with the traffic of the truck drivers that are coming to the border. That has been our major challenge. But I'm glad to inform you that today we received additional 4,000 nasopharyngeal sample kits, which will quickly deploy to the border region to be able to unclog this backlog.
So how soon do we expect that to happen?
This will happen beginning tomorrow. We'll be able to deploy quickly the kits that we have received, so that we can be able to remove the backlog and the snarl up of the traffic between Malaba and Uganda border.
Director General, you see that traffic that you're talking about then essentially poses a threat to the people living around there, because the truck drivers are still mingling with them. What measures have you put in place to ensure that those same truck drivers, as they wait for their tests, they're not exactly mingling with the community there and essentially spreading the virus?
We have communicated to the truck drivers to ensure that they self-quarantine when they reach the border points and as they wait the clearance process. And we have also been in discussion with Kenya Transporters Association to ensure that the truck drivers at least have a test before they commence their journeys. You remember, Uganda is a landlocked country and receives most of its supplies through our port of Mombasa. So it is our belief that if we can be able to quickly test the truck drivers in Mombasa before they commence their journeys, and using various innovations, we can be able to share the results of their test results with the border points. so that we are even thinking of having an express lane in Busia and Malaba, in which case your test results were received way before your arrival. Then your passage through the border is fast-tracked. That we think will be able to address this challenge. And the testing at the site before commencement of the journey is key. We want to deploy it in Mombasa. We want to deploy it in Mlolongo in Nairobi. And we have also started testing in Eldoret through our facility, the Moi Teaching Referral Hospital. And of course, Kisumu, we have 2 laboratories, the Kemri CDC laboratory, and of course, the other Kemri laboratory in Kisumu, which can be able to quickly address this. Remember, because of our trade links between us and Uganda, on average, we have 350 trucks going outbound and another 350 trucks inbound. So this is something that we had anticipated to happen. But had it not been for the supply chain challenges with the test kits, we would have averted this problem.
But DG, now you say inbound is 350 and outbound is also 350. Uganda authorities have said, though, that once the trucks cross over to the other side, then other drivers will take them over. Does that also apply in reverse?
Oh, that is in the purview of the Ministry of Transport and Ministry of Trade, and I'm sure they'll be able to have those discussions to be able to address it. What is imperative for us, of course, is to ensure that on our side we are able to quickly test the drivers, quickly relay the results to the border points, and ensure safe and quick passage through the border to ensure unrestricted cargo movement between us and our neighboring countries.
So, DG, paint for me a scenario where a driver tests positive and the truck is already at the border point. So, what happens? Does he have to wait for another driver to come and pick the truck and then it's driven away? What happens now?
In case a driver tests positive, of course, that is a person that is quickly moved into the isolation facility. As arrangements are made between the owner of the truck and the relevant government authorities to be able to move the cargo, the truck and its contents to the desired destination.
So, DG, finally, if somebody wants to test, where do they go? Because there's also the concern of where do I go if I want to test as an individual if I don't have the money for private testing?
Oh, we have 16 designated testing facilities and more are coming on board. 5 of these facilities are located in Nairobi. 2 are at the National Public Health Laboratory, the National Influenza Center. We have the HIV reference laboratory at the National Public Health Laboratory. We have 2 testing facilities within Kemri headquarters itself. And we also have Kenyatta National Hospital, that is for Nairobi. In the western part of the country, we have 2 laboratories in Kemri, Kisumu. In the North Rift, we have Moi Teaching and Referral Hospital facility. At the coast, we have Mombasa Coast Provincial Hospital and Kilifi Kemri Welcome Trust. And today we started test runs in Wajir County Hospital to be able to serve the northern part of Kenya. That is Mandera, Isiolo, Wajir and Garissa. And of course, more testing sites are coming on board, including discussions that we are having with the Institute of Primate Research, ILRI, in line with the One Health approach where the people, the environment, animals are closely interrelated and disease can jump from one part to the other. Therefore, we want to bring also the concept of One Health for us, and ILRI is going to come on board in the next 1 or 2 weeks, and more others will come as we work on the testing menu.